Hi, let me give you some information about pernicious anemia. Pernicious anemia is an autoimmune condition that prevents the body from absorbing enough vitamin B12 from the diet due to a lack of intrinsic factor, IF, a protein made in the stomach. This leads to a deficiency that impacts the body's ability to produce healthy red blood cells. The primary cause is an autoimmune response where the immune system attacks the parietal cells in the stomach lining that produce intrinsic factor or the intrinsic factor itself. This means B12 cannot bind to IF and be absorbed in the small intestine. Risk factors include family history of the condition, Northern European or Scandinavian descent, presence of other autoimmune disorders such as type 1 diabetes, thyroid disease, Graves' or Hashimoto's, or vitiligo, certain stomach or intestinal surgeries like gastric bypass, which remove parts of the stomach or small intestine. Symptoms. Symptoms often develop slowly and can be mild at first, becoming more severe over time. They can be divided into general, gastrointestinal, and neurological. Category symptoms: general fatigue, weakness, pale or a lemon yellow skin tone, shortness of breath, dizziness, and a rapid heartbeat. Gastrointestinal A: smooth, red and sore tongue, glossitis, heartburn, nausea, loss of appetite, and changes in bowel habits, diarrhea or constipation. Neurological numbness or tingling in the hands and feet, paresthesia, loss of balance, muscle weakness, confusion, short-term memory loss, and depression. If left untreated, the nerve damage can become permanent. Diagnosis. Diagnosis can be challenging due to the slow onset of symptoms and overlap with other conditions. Tests may include complete blood count, CBC, to check for anemia, and the size of red blood cells, which are typically larger than normal or macrocytic. Vitamin B12 level measurement in the blood. Antibody tests for intrinsic factor antibodies, highly specific to pernicious anemia, or parietal cell antibodies. Measurement of methylmalonic acid, MMA, and homocysteine levels, which are typically elevated in B12 deficiency. Treatment: pernicious anemia cannot be cured, but the B12 deficiency it causes is easily treated with lifelong vitamin B12 supplementation. Treatment usually involves intramuscular injections of vitamin B12, hydroxycobalamin or cyanocobalamin. These are frequent at first, e.g. daily or every other day, to build up stores, then reduced to a monthly maintenance schedule. In some cases, high-dose oral supplements, liquid or nasal gel, sprays may be effective for maintenance after initial treatment, but injections are standard. With proper treatment, most individuals live a normal life. However, regular monitoring for complications, such as an increased risk of gastric cancer, is recommended